Being a chartered manager means that you are a specialist in that area, and it means you've got all the skills to do the job to the best of its ability.
You are seen as a leader, a true leader who has credentials behind the great work you've already been doing.
It's enhanced my understanding, it's enhanced my skill set, it's improved my mindset.
It makes all the difference.
This session is recorded and will be available on the CMI website and YouTube channel. Join the conversation by using the live chat box for your questions and comments. We'll answer as many as we can during the Q&A.
Good evening, everyone, and welcome to today's digital event, Enterprise Leadership in the NHS Collaboration for Lasting Impact. My name is Amelia Phillips, and I'm an Event Delivery Coordinator at CMI. Don't forget to join the conversation by using the live chat box, and feel free to ask any questions you have for our speakers, and we'll answer as many as possible during the Q&A session. I will now hand over to Katie Joyce, the Event Lead for the North East Yorkshire and Humberside Regional Board, to begin today's event. I'd also like to congratulate Katie, who has been announced as a finalist for the Northern Power Women Awards in the category of 2026 Person with Purpose Public Sector.
Hiya, thanks Amelia. Hi everyone, good evening, and thank you for joining us. So in this session, we're going to explore enterprise leadership in the NHS and how collaboration can be used to drive lasting impact. So when we're thinking about enterprise leadership, we're thinking about how, as leaders, we see the bigger picture, how we look at organisations as a whole. And I guess when we think about the NHS, whilst a foundation trust, for example, or a hospital group is just one big, large organisation, but actually looking at the NHS as a whole, just in our region, we've got 8 acute provider foundation trusts. So how do we all work together? And that's just one region. How do we then work nationally as all one NHS, with the same goals and heading in the same direction? And then not just that, but how do we collaborate outside of the NHS as well with other parts of the healthcare system, such as pharmaceutical industry, and really make decisions that are for the collective benefit. So I'd like to introduce some experts who are going to give us their insights. So I'm delighted to be joined by Matt Brown, Managing Director at NHS North East and North Cumbria Provider Collaborative. I'd also like to welcome Jim Potter, Head of Market Access at the biopharmaceutical company Celltrion Limited. And we also have Professor Ewan Maule, Clinical Director in the North East and North Cumbria Integrated Care Board, also Chair of the ICB Chief Pharmacist Network. So hello, welcome everyone. So get straight into it. I'll launch into the first question. So this one's for you, Ewan, and it's, why does enterprise leadership matter to the NHS?
Yeah, thanks, Katie. I think your introduction was right. First thing to say is the NHS is mad, right? It's not one organisation, it's thousands. People on the outside might think, well, the NHS is doing a thing, or the NHS is going to do a thing. And I think quite often politicians struggle to understand this as well. They speak to the head of the NHS and say the NHS needs to do this thing, and then struggle to understand why it doesn't just happen in the way it would do if it was a single organisation. But the NHS is actually thousands of organisations, and there isn't a single problem that the NHS faces that can really easily be fixed by a single organisation, a single profession, not even a single budget. It's not a case of just saying that thing over there, fix that in isolation. It's also interconnected and interdependent. And we're operating across organisational and functional boundaries. So, for example, we've got foundation trusts are their own statutory legal entities with their own boards, their own obligations, their own duties. And so to say to them, well, actually, we think you are going to have to, do something difficult for the benefit of another part of the system is actually really difficult because, firstly, they don't necessarily want to, they don't necessarily see the benefit of it themselves, and they might have to give something up on the way to doing it. So that's really quite challenging. Quite often when you optimize one part of the system, what you're doing is you're actually just displacing pressure elsewhere, or you're creating a different type of pressure somewhere else. And so that idea of getting a collective kind of sense of trying to fix something for mutual benefit or for wider benefit, or in our case, more importantly, for the benefit of the population that we serve. It's a really difficult thing to do practically, but that's ultimately what we're there for. And I think that's one of the complexities in NHS leadership is that what would seem so obviously to be the right thing to do is not very often a very easy thing to do.
Definitely. And so collaboration is definitely essential in the NHS. But Matt, how do we get the right people on board?
Yeah, thanks, Katie. Thanks, you. And I think you've prefaced this really, really nicely. So just for a little bit of context, I'm Managing Director of the Provider Collaborative. So that means I'm directly accountable to the 10 Chief Executive of 11 Foundation Trusts here in North East North Cumbria. I've been in this role for 4 years or so. And I think the best way to describe my job is it's about supporting our foundation trusts to work together on the things that make sense to work together on. And I choose those words quite carefully, to be honest. It sounds a little glib in one sense, but it's the best way I've found of describing the work that I do. The best way to think about our provider collaborative is with a small p, the way we choose to collaborate rather than some kind of separate entity. I think that's really important. We've got a number of strategic priorities that we've set together. As Ewan said, some big complex things to tackle. So clinical service sustainability, our collective workforce challenges, and how we put in infrastructure that makes sense. So digital diagnostics, allowing us to request and see scans and images across the region. And also to try and tackle the really substantial issues we've got about capital, estates, buildings. So the way we involve people is through a distributed leadership model. So each of our 10 chief execs takes lead on one or more programs. And within those programs, we have a triumvirate approach. So a chief exec SRO, a functional director lead from one of our FTs, and a highly skilled program lead. And I think that's really crucial in taking forward collaborative programs. So we've learned through sometimes quite bitter experience that programs just don't function if we're missing one of those roles. So either you haven't got sufficiently strong leadership mandate across organisations for the chief exec, we don't get the buy-in from our director teams if we haven't got a functional lead, and if there isn't a program lead, quite honestly, nothing happens, nothing's taken forward. So where we have programs where we can't identify that triumvirate, we just, my advice is always, like, we don't rest, we stop, we focus on something else. And leads you quite nicely, really, onto the most important part of our operating model, which is a really relentless and ruthless pursuit of purposeful collaboration. So we only choose to take forward those things that genuinely make sense for our organisations to work together on. Again, it sounds a little glib, but I think that's really important. So we use a kind of triangular model to articulate this. So if you imagine around about 80% of the things that FTs need to do actually need to be done individually. Maybe about 15% or so there's benefit from some kind of collective dialogue, sharing, best practice, shared learning. And maybe 5% benefits from collective actions, collective interventions, collective solutions. Numbers themselves aren't that important, although as a mathematician I find that slightly difficult. But the point is that it's actually quite a small proportion of our work that organisations do where there's really substantial benefit. And it tends to come down to those kind of complex, wicked issues that Ewan started to talk about earlier. That 5% is very much, where's the common ground? Where's the mutual benefit? And we use a series of questions to tease that out for the provider collaborative here. So a 3+1. And those questions are, firstly, is there genuine benefit from a collective action or collective approach? It's surprising how often, actually, when you boil it down, the things we get asked to do, it's quite difficult to see what the benefit is. Secondly, does that collective benefit outweigh the cost and the resource of implementing it sufficiently, in all likelihood? And sufficiently being the key word. Is it worth it overall? And lastly, does the benefit outweigh the costs sufficiently for individual trusts to prioritise this over something they're already doing? Because actually, people are busy. So we're adding things to our existing workloads. So if we say no to any of those questions, we apply a fourth, which is, are we comfortable with their level of ambition? So there was a bit of a check and balance. And I think we're quite hard-nosed about what we focus on through that. But the consequence of that is being really committed and really successful. I think the last thing about making sure we get the right people on board is the relationship between the chair of the collab, who's Ken Bremner, one of the chief execs of one of our FTs, and myself as an honest broker, the managing director. And between us, we try to navigate what's quite a tricky path in terms of where our organisations are. And we'll talk about that in a little more depth in some of the other questions, no doubt.
Yeah, absolutely right, Matt. I guess that's really interesting, is not just collaborating for the sake of it, but looking at where is actually that collective effort worth it, and when should we put in that time and resource to all work together? Because as we're going to talk a bit more on later, there's some real challenges to trying to collaborate across organisations. And is it worth overcoming those challenges for something that's maybe not going to have the outputs that are worth that amount of effort? But I guess in this example that you're talking about, Matt, we're talking about the provider collaborative. And whilst everyone's got their own priorities, the stuff that people are working together on with a collective goal, everyone's trying to head in the same direction and wants the same same outcome. So Jim, that brings me on to you in the private sector, where actually there might be very different priorities, you know, for the private sector and NHS working together. There might be very different priorities about profitability, about competition. So how does collaboration look for you?
Well, thanks, Katie. It's a great question. I think that the first thing that really underpins everything is that you need to instill confidence and trust for everybody that's present. You've gone through that phase of identifying the right people. You've got the right people in the room. They've got the right knowledge. You have to make sure that they are confident and trust that anything will be shared will not be disclosed in a confidential manner. Part of my role, I actually am a vice chair of the British Biosimilars Association, which is an industry organisation for the off-patent sector, and I have to deal with this quite regularly. One thing that I did when I stepped into that role was to actually identify that we needed to set some ground rules right from minute one, really, and we developed a series of protocols which were quite clear about what can and can't be discussed, what should be left outside at the door before the meeting starts, what should be in scope of any conversations, what type of confidential information should deliberately be avoided in conversation. And I think that overall that setting of ground rules and that framework has really enabled that particular organisation as an example to drive forward and actually achieve some real great goals over the past couple of years. And I think that whole premise of right people in the room and instilling confidence that anything that's shared is in confidence and won't be shared externally in an inappropriate fashion, that's key to everything.
Definitely. And I think, Matt, when we've talked about this previously, we've talked about some of that same principles need bringing in with the execs and with the acute providers, isn't it? And kind of where there's things that need to be left at the door and what needs to be brought in the room and siphoning that off.
Definitely. And the specifics of the principles we might set are slightly different, but the act of going through the creation of them is partly about working out how you're going to work together, isn't it? So it doesn't really matter what the output of those principles are, what they say in the end. The question is, how have you developed them? How do they reflect the way in which you want to work? So yeah, it's exactly the same with us. Quite a lengthy process to get them agreed, to be fair.
So breaking collaboration down then, what are the key components to successful collaboration? And I'll come to you, Ewan, on that one.
Yeah, thanks. I mean, I'll start off on this, but I think others might have a view as well. So I think there's a number of different things. So one of the things that Matt and James have spoken about a bit is understanding a shared and specific purpose. And quite often people start with the process. How do we collaborate, rather than actually, why are we collaborating? Is collaboration really genuinely essential on something like this? And if it is really genuinely essential, does it feel that way to everybody involved? Does everyone feel that there's a benefit in collaborating? Because it's a hell of a lot easier to get people to collaborate if people are coming willingly to the table. If you think the solution involves 10 people, but only 3 of those people actually feel like collaboration is the answer, then you're in a very different place, and people are bringing a different set of baggage into it. So I think if you're the person who's kind of kicking off the discussion about collaboration, I think spending some time in advance thinking, what baggage are people going to be bringing in? Is everybody coming into this with the same understanding? I think is really important. So I would always start with clearly defining what the problem is, checking everyone is on the same page with the problem, and an understanding of what ultimately the long-term solution that you're aiming for might look like. Not in detail, because it will vary, and quite often you start with the problem and don't know what the answer is, but you just know that collaboration is going to be a part of it. But I think that's a really important part of it. I think when you go through the process of collaboration, there's also something about accountability. So I think people can sometimes feel as though collaboration means that everyone owns everything, and actually it's not. Collaboration is kind of a willingness to work together. It involves trade-offs. It involves people giving up certain things in order to gain other things. And so clarity about who's deciding what, who's delivering what, and who's carrying what risk, I think is a really important part of it. And that bit about trade-offs and compromise is really important. Quite often people come in, and I know, Matt, we've certainly seen this in the NHS, as people come into collaboration meaning, well, I'm already the best, so therefore my collaboration is I'll help other people be as good as me. And actually that's not collaboration. That's not the same thing. So I think if no one's giving something up, or if somebody's not giving something up, then it's not really genuine collaboration. So I think that's an important point. I think something else, and again, this probably feels quite relevant to me working in the NHS, but I'm sure it will in lots of other fields as well, is there's got to be, as well as the purpose has got to be something that kind of fits with people's ethical or moral beliefs. There's got to be a feeling that doing this is the right thing, particularly when talking about enterprise leadership and working across organizational boundaries, and it makes trade-offs much easier to do and compromise easier to do if you know that you're doing it in pursuit of doing the right thing. Matt mentioned his role as being kind of an honest broker, and I think quite often I found myself in a similar situation when you're there not because you're trying to pursue something that is right for your organization, but because it's the right thing to do, and other people need help getting to the place of recognizing it's the right thing to do. And even when people do, sometimes they still don't want to, because the organizational or professional or personal things that they have to give up are sometimes feeling a bit too difficult for them. So I think those are some of the components, but I think there's other stuff. I think momentum as well. So firstly, some early wins so that you kind of get people on board and kind of keep people on board, but keeping that kind of constancy of purpose and momentum. Where are we going? Why are we doing? Keep coming back. As long as you've got the ethical anchor, then you can keep saying, right, this is why we're doing it, but you need to keep the momentum. If it just drags on and every meeting feels like we're talking about the same stuff again, then people disengage with it. And the other thing that kind of my final point, and this is about the governance, has got to be proportionate, because quite often people will say, the governance is this, we've got to report there, we've got to fill out a thing for that, and it becomes a process of fulfilling governance requirements. I think you've got to have some structure at the beginning so that people have got some confidence that this is something more than just a conversation, and it helps to build the momentum, but not replacing action with process. So I think they're the key components. I think even when you do all of this, it doesn't necessarily work. So there's something about also sometimes knowing when to give up, because frankly, if you try and drag people through collaboration, it doesn't work. I think Matt and I have worked and are continuing to work on a fairly significant collaborative project called the Medicines Manufacturing Centre in Northumberland, which I think, Matt, we would probably both still kind of bear the scars from, but that the ethical anchor, the accountability, the understanding of the purpose, all that kind of stuff has been there. Some of it's been really challenging, but all of those kind of components have been there. And I think that's why we've got to the point that we've got to.
And we're definitely not giving up on that one, are we? I think it's worth saying, that one, really tricky supply chain resilience for medicines, a challenging financial position, difficult recruiting staff, something that all of the organisations wanted to do, all 8 acute trusts in this example. And where we had access to some capital to be able to support it, so really a kind of win-win. But even with that kind of win-win position, it's been quite a challenging thing to land. Once you get into the detail, understand that the organisation's different appetites for risk, the different financial positions, the different kind of cultures, it becomes tricky making sure that what you're doing is consistently fair, that works for everybody, that delivers a good output for everybody, that everyone's equally contributing. And also, people are busy. So making sure we're briefing people at the right points with the right information that helps them keep their boards up to date is a challenge, because when it's interesting and hot, it's important. But actually, the key thing was to build up knowledge and ownership about 3-4 months before that, really. So yeah, it's a tricky thing to land. I think with the Medicines Manufacturing Centre, it's really exciting. It's nearly there. It's nearly built. We're going to be producing medicines before too long, so it's a good example.
Soon.
Yeah.
So what's really stood out from just the comments from both of you just then is how important communication is in all of that. So, and the language that's used around the purpose and around the urgency. So I guess what stands out for me in healthcare is that the language, if you want someone on board in a collaboration, the language that you use with, say, a finance director is going to be very different language and a very different story to how you're going to actually present the exact same problem and the exact same collaboration to, say, if you're speaking to the clinical director or the operational director. And it's being aware, I think, of what the language of those individuals are and what purpose are they, coming to work every day for, and are you tapping into that purpose and are you communicating that continuously? And I guess also creating that urgency of why should everyone be on board now? Because as you said, everyone's got their day jobs to be doing. Everyone's busy. Why should they be involved in your collaboration now?
And sorry to interrupt you, Katie, and not just that. I think I think that's critically important in itself. The benefits, say for example, the Medicines Manufacturing Centre, don't apply equally to the different organisations. So some benefit more from the financial resilience, some from supply chain resilience, some from the workforce challenges. So the way in which we describe the same solution is quite different actually, and then describing that in a way that provides real confidence to boards is quite a challenge to make sure you kind of land that collectively. So you're absolutely right. The language, the way in which we think about the circumstance of the people we're talking to is really important.
And Jim, so I guess with private sector, how much does this reflect what you experience?
Well, thanks, Katie. It's really interesting just listening to the comments, and I do echo all of the comments, because when you actually strip everything back, it is exactly the same process, whether it's private sector or not. Within the private sector, at times it can be certainly a very competitive environment, but that isn't necessarily just specific and bespoke to the private sector. I think that overall there are a series of principles that need to be adhered to actually collaborate effectively. And I think those things that were commented about, actually setting the ground rules from the beginning, but also making sure that the right people in the room are there and they know why they're in the room, and focusing on the specific topics that will be addressed during that meeting. And also the whole concept of getting the quick wins from the outcomes from that certainly the first one or two meetings of that collaboration. I think they're really vitally important, because that instills more confidence in everybody that's taking part to actually drive forward with it. I think that it's back to some of the comments that we mentioned earlier on. There has to be a willingness to leave some things at the door based on an identification and a shared objective of what is the topic that will be focused on during this meeting. What is the goal that we're all here to achieve? What are we actually trying to actually achieve as the outcome from the meeting, or the task group, the working group, whatever it might be? I've obviously got lots of experience from working within industry, but also I've experience of working with charities, and also collaborations between industry and NHS. And no matter what environment it is, the core principles are exactly the same. What does change is the point that you made earlier on, is the message that's given and how it's delivered. So then one of the key elements again is about knowing who's in the room, what message needs to be conveyed and in what form to that person, so that they understand, they feel confident, they contribute, they feel as if it's that there's more benefit from the actual meeting and the process. So I think that all of these things considered, yes, it's very much the same within private sector, but also there are slight changes, whatever environment that you have to make specific to whatever the meeting is.
Definitely. And I guess the other thing with that communication in those messages is that remembering that the communication is two-way, and there also needs to be that constant feedback as well. You're constantly sending out those messages about how things are going, what the progress is, but actually what is the feedback mechanism to hear back from those different organisations or different functional groups to know what their needs are and maybe where there's differences needed. So I'll jump on to...
Sorry, Katie, just to say, I mean, absolutely, I totally agree with that comment that you just made. I think one of the other things to add about it is that one of the key things, if you are the chair of the group, if you're leading the collaboration, is that checking exercise, both in advance and critically post-meeting, so that you can gauge the temperature of how people have felt that it went, and then you can adjust for subsequent meetings, because obviously the goal is to make sure that everyone's happy and confident in contributing, so that we can all achieve that shared goal.
Definitely. So we've talked about some of the challenges already, they come up quite naturally. So Matt, could you share some of the common challenges, but also what solutions that you've found to keep things moving forward?
Yeah, and we have touched on a few of them already, I think. But I mean, for me, the first challenge is, like, quite honestly, people are busy. People have got day jobs. There's not many people in our world who are sat just waiting for us to give them something to do. So it's not enough for a project to be a good idea. We've got lots of good ideas. Take you back to the questions on purposeful collaboration. We've got to be really clear about why we want to do this and why we want to do it together. And we're genuinely committed to doing it. And so, certainly for us, we've got a really brilliant, small, dedicated team of highly skilled managers and leaders, including Katie, to support our collaborative work. But there has to be skin in the game. Organisations have to be able to commit time, leadership, ownership to taking forward programs. Otherwise, they've just simply got no chance of success. So I think that's a real challenge. And it's partly why we focus so ruthlessly on being kind of on purposeful collaboration. If we can't genuinely prioritise enough time to do it, then it's just not going to work. Ewan talked a little bit about the governance being proportional. I think that's really key. The governance is important, but it's not enough on its own. So we spent a lot of time when I started in this role building the governance and getting that agreed by FT boards, and it was a little torturous at times. But to be honest, we haven't really looked back on those documents since. As the work we did in building them, in figuring out how we were going to work, has stood us in good stead. And in many respects, the process of developing that governance was more important than the outputs in terms of that challenge. So just a little context, we have a provider leadership board. That's where our chief execs come together. Then we have a series of program boards, each which is chaired by a chief exec. That's how we work. I do think a sort of challenging solution from a governance perspective, one thing that's really important is being really clear on precisely what was agreed where and by who. So I'm never failed to be surprised by how many different perspectives and interpretations we have on what we've agreed at the end of some meetings. So in terms of governance, after I provide a leadership board, myself and the chair have a quick conversation about clarifying exactly what we think was agreed. We circulate that back to chief execs and we have a discussion about that by email before, and we kind of clarify the messages that are going out to teams. That's really important, making sure that we're all really consistent. I think governance is important, but it's not enough on its own, is it? The reality is the way we keep moving things forward and tackling these challenges is the long, hard slog behind the scenes. It's time spent listening to people, talking to people, understanding where they sit because they all have different priorities. Probably more importantly, as we said earlier, understanding the different cultures and different risk appetites of our organisations and which problems are most important to tackle and therefore which solutions are key. So I don't think there's really a shortcut for successful cooperation. I think to some extent it has to be difficult. It has to be constructive, but I think you have to get into that difficult territory. If it's easy, my view is generally that means someone simply isn't putting their issues onto the table. We're not, we've got a recipe for future problems and slower progress if we're not tackling that. And we certainly locally are getting better at that over time. I think when I started, people were quite guarded. But as we've delivered our programme of work, if we created a safe space to discuss things, I think that's certainly got better. One thing we try and do locally is by explicitly asking people to tease out those things that are contentious for partners in meetings and presentations and kind of putting that on the table at the outset. There's an expectation that we talk about difficult things. I think it's important, and it's a useful way of making sure we don't skirt over things that are going to be problematic later on in the future. I don't know what I should say, but certainly when I first met my wife, one of the things I said to her was, if there isn't some conflict, then someone's voice isn't being heard. Now she reminds me of that a lot. But I think that's an important lesson in life and in work, isn't it? And another thing that strikes me, as Ewan said, we mustn't be afraid to fail. We're not going to get everything right. So quite a lot of the first projects we took on initially, they probably weren't really that successful in terms of the outputs we developed. But what we did do is build the basis of honesty and openness and a trust that we can work together. So if I may, Kate, just a brief example of that. Back in 2022, we were looking at mileage rates with our chief people officers. So it's about the time Russia invaded Ukraine. Fuel prices were spiking and there's a lot of concern about cost of living, fuel poverty. And certainly where we are, a lot of our FTs are very close together. So staff were moving between organisations with a lot of turnover and disruption for them and for the organisations for quite small differences in reimbursement. So we thought, right, we'll try and be consistent on mileage rates, quite a simple thing. We did loads of work pulling together data, baseline views, and figuring out how we could synchronise them. But actually, something on face value seemed quite simple was really complicated. And actually what we could see was just the tip of the iceberg, because the mileage rates are an intrinsic part of the wider terms and conditions, the way lease cars are used in different organisations, the different virality, the different level of community service infrastructure. So actually we concluded we really couldn't do very much with it. We could take some small convergent steps over time, or at least not take divergent steps, but there wasn't a great deal we could do. So in some sense, that was a bit of a failure. But what it did lay is the groundwork for what we're doing now with our chief people officers, which we hadn't done at all before, So by getting them to share data and share information in a really psychologically safe space, having some really frank conversations, off the back of that, we've developed relationships where we're now looking at much bigger solutions for shared services and synchronization on occupational health, bank, recruitment, sickness absence, salaries. So we've got to some really big benefit unlocked by actually being prepared to say, we'll not be able to make this work, it's not going to work for organisations, and building trust in the first instance. That for me has been really helpful. And I think there is a bit of a trade-off between kind of my mantra, which is going where the energy is, and thinking about what the things are that we should be doing. They don't always sync, but what we found in general is that where we've gone where the energy has gone, where organisations have real commitment and energy, that we've been able to build a kind of basis or a case for tackling much bigger things over time. So I guess for me, those are some of the challenges and solutions. I don't know if that's helpful, Katie, and perhaps I went a little bit too close to home there.
I do think sometimes, though, the things that are really hard and really challenging is where collaboration and a collective energy can work best to tackle it together instead of everyone trying to tackle it individually. So thinking about some of the even technical challenges with, trying to make the NHS as digital as possible, when there's so many organisations, as we've mentioned, in the NHS, and a lot of those have different electronic systems, for example, that have been implemented, and then you need those systems suddenly to be able to talk to each other, to be able to share those patient records. That's not an easy task. It's a technical nightmare because the coding might not align. There's so many issues. You're getting two private companies to then work together to say, we actually need you to come up with a joint solution for NHS patients. And that won't happen with just one little voice saying we need this. But actually, if you have the whole NHS or all of the organisations, in the North East North Cumbria collab together and say, we need this collectively, it can really have that positive influence to drive what you want to come out of it.
And there's something, apologies.
Sorry, I was just going to say, the thing is, we don't have to look too far back into the past to see that happening, because it happened in COVID. We changed the world, we ripped up the rulebook, we did all sorts of incredible things in COVID because there was a burning platform, because we all had to, and everyone understood the need for it. There was that ethical anchor for it. We all knew it was the right thing to do. People gave up all sorts to make that sort of collaboration happen. And we kind of need to remember some of those lessons, that when we don't have the burning platform, that a good thing is still a good thing to do. But yeah, I just think it's not that long ago that we learned how to do this really well, and it's a bit of a shame that we've forgotten lots of it.
I suppose that part of the lesson from that is we had a really simple, crystal clear purpose and shared kind of focus on what we were trying to do, and so it's replicating that with some of these things. So with the digital solutions, well, what information which people need to see what information, and hence does that need to be shared? Who needs access to what? If you boil it down to a really low kind of detailed level, it's easy to solve some of those problems. That's something we're doing with oncology, looking at actually when we got into about how you help oncologists work across different trusts. It comes down to, well, can you access the Wi-Fi? What happens when you get logged out and you get timed out from the system? So quite simple, basic things. And as you gradually build those up and address those, I think it takes us forward.
So, Ewan, can you give me, in the interest of time, your 3-minute highlight reel of the key skills and attributes that leaders need in order to leverage the skills and expertise of a range of stakeholders? Yep,
I will do my best. I feel like a bit of a fraud answering a question like this, but I'll tell you where I've seen it done well. So clearly the skills they're not technical skills. It's relationships and it's behaviours. I think for the ones I've seen and do it best, it's not about being the hero, and often we think of leadership as being the hero, the strong voice, the front person. It's not. It's the opposite. It's about being the servant. It's about the one who's making it as easy and comfortable as possible for everyone else to do the things that they need to do. I think a really important skill is being insightful, knowing the things that are said and the things that aren't said, and why people are behaving the way that they do. And that's the stuff that really interests me. I don't quite know how I ended up being a pharmacist, because I think I really would have been better off being a behavioural scientist, because that's the stuff that really interests me. Somebody said this thing, they actually mean something completely different, and this is why they actually mean that thing that they mean. So I think there's something about not just taking what people say at face value, but being prepared to kind of explore underneath some of that. I think to do this kind of stuff, you've got to be capable at principled pragmatism. So knowing what's the battle and what's the war, what are you willing to give up, what are you willing to take one step back on for this in order to get 2 steps forward on that. Being a bit opportunistic as well. So Matt says go where the energy is. I would rather say kind of being a bit opportunistic and not wasting a crisis. If someone's jumping up and down about something, then go to where they are and try and solve that problem, because that will probably bring all sorts of other good stuff along with it if you can capitalize on some of that. Not underestimating how long it takes to break down some of that historical mistrust or the professional defensiveness. I know programs that I've been involved with where the first year is just breaking down egos and getting people in the room to talk openly. And then only once you've done that, you can start to make really good progress, but you've got to kind of make people feel important. And that's a big part of it. Judgment, obviously, knowing how to challenge people, when to challenge people, and how to do it safely in a way that doesn't kind of jeopardize their participation in the process. And something else that I think, and I will mention Matt as an example of this, because I don't know that I've ever seen anyone do it better, but emotional discipline. So not losing focus, not losing clarity when things get uncomfortable. There's been a number of times when I've kind of got riled up about stuff and I've said, Matt, you'll never believe what so-and-so's done and said. And he always kind of goes, all right, let's just take a deep breath, take a step back, calm down, think about what's happening. And then, we'll not jump to do something, we'll just process it and it'll come out in the wash. And I think that's a really, really important skill, not losing the focus when things seem to be kind of kicking off. And the final couple of points I would say is about being resilient, but not being arrogant, and finally asking for feedback, because we all hear our own voice and hear what we say and assume that it comes out as what we think it means, but it doesn't always, and it lands differently with different people. So don't be afraid to ask for feedback. I hope that was 3 minutes. Sorry, I wasn't timing it.
It was about, actually. It was pretty accurate. Okay. I was going to say from that, you kind of touched on it without saying the words, and I feel like we can't have a whole session on collaboration without saying the word psychological safety. So I'm just going to say it now. But I guess it's creating that trusting environment where people are going to bring forward honest feedback and challenges. Otherwise, I think collaborations just don't really work. And I think we've got a good example with the provider collaborative, where certainly with our Medicines Value programme, where it's got the ICB or the Integrated Care Board, who is the commissioner, involved in that. And I think what we've been really careful about is making it not feel like something has been done to the providers, but it's been done with the providers, and the commissioner is not there to be threatening. So we've really tried very hard to not create any defensiveness and really have an environment where people can be very open and not keep things hidden because they think it's going to be used against them in some way. So I think that's really important to create. And so just to expand on those skills a little bit further, Matt, thinking about your personal journey in leadership, how have you honed your leadership skills to get the best out of people?
Well, I have to say it's good of you to know my emotional discipline. I'm not sure if you saw me with the children earlier on this evening, whether we would have agreed with that, but that's very good. I mean, I think I actually echoed a lot of what you had already said. I think that the term that attracted me to this job was the term honest broker. And I think that means trying to understand where people are coming from, and that comes from spending time with people, such as honing that skill. It's spending time with people to see what their worldview is, what their situation is. And almost always, when you spend enough time with people, you can really see that their perspective comes from quite a rational or quite an understandable place. And I find if I can't see the reason for that sort of thought process, it's usually because I haven't spent enough time with them. And that, to me, is about being able to see the world as it is without judgment, rather than how it should be or how I might want it to be or how other partners might want it to be. But this is the way the world is. And if you start from that place, you're on a much better footing, I think. Listening. It's just about listening, isn't it? Not judging, and then helping. I think, as Ewan says, helping put issues on the table for leaders to consider in a managed way. It's not shying away from it. You're right, Katie. It's getting into some crunchy discussions, isn't it? It's using good relationships to have psychological safety, so it can have difficult conversations to move things forward for our patients. So I think that's really important. Adaptivity is really, really, really key for me. So each chief exec I work with works very differently. Each organisation is different. So I think being able to flex, and there are some core things that I guess most of us would say are important about openness, about honesty, about accountability, holding yourself to account for what you've said you're going to do, and integrity. So the way in which we choose to interact with all the people we support is really key in collaboration. The last thing on my list was psychological safety, Katie. So you've been with it, definitely. A very specific thing I've been doing recently is training on executive coaching, and I think it's quite a useful skill, really, be able to really appraise how well you listen to other people. I realised perhaps I wasn't quite as good at it as I thought it was, and then be able to offer those kind of pearls of wisdom, those insights, those reflections back to people so they can tackle their collective issues together. So I think that's pretty useful. I guess those are the things I would say.
Yeah, I definitely agree with those last ones as well about listening. And, I think one of the things that I've learned over the last year in my own sort of leadership journey is not always, my brain's always buzzing thinking about the next thing to say or the next thing to basically mind running away with itself, but actually there's something in just sitting back and listening to what people have to say and actually being comfortable with silence. And I think you're quite good with this about just let people be silent and someone will speak. You don't have to be the one to speak, just sit back, be silent, and someone will come in at some point. And that might be something that's really important to hear.
I mean, that's usually because I don't know what to say.
Well, it might be that, but it works.
but I think there is something very important in that, is that people feel uncomfortable with silence, so somebody will speak. So you don't have to force it as long as you're comfortable with the silence. But it's often, I think, particularly in our profession, Katie, as pharmacists, quite often people are reflective and they take a little while to think things through. And so the good stuff comes out after a bit of a pause. So if you encourage that to happen, then the good stuff comes afterwards.
Yeah, it's definitely getting comfortable with that silence in a meeting is a skill, I think, in itself. So coming on to the last question that I have, and then we'll go to some questions that were from audience members putting in beforehand and during the chat. So this one's for you, Jim. So what tips would you give to a leader taking their first steps towards collaborating beyond their usual sphere of control and influence?
Another great question. Thank you. First of all, I think that principle one is relax. So you're there for a reason. You're in that position for a reason. Importantly, I think prior to any activities in the meeting itself, I think you need to take time to consider what you want to achieve, both personally and the overall outcomes from the collaboration, from the meeting. I think that what you need to do is, through the process, prior to the meeting, during and post-meeting, build those relationships with the people that are part of that team, of the collaboration. You'll get the results that you'll get eventually will be much more significant and of higher caliber and value to everybody concerned. If you have built those relationships, you'll be able to know what each individual has to offer, what they want to achieve, and as a result, eventually you will get to the outcome that is a much more desired outcome overall, as well as being focused on achieving what the goal of the meeting was, of the collaboration. I think that key to all of that is again, prior to the meeting, but you develop it up through the process, is that you need to create that right environment. So back to what was said earlier on about the instilling the feeling about confidentiality, freedom for whomever's within the group to be able to share their views and any information without any fear of it going anywhere untoward. You've got to definitely maintain that during the meeting and keep reminding people of it at certain points. I think that you need to be honest, transparent, be able to, if you need it, to be able to seek support from the group or from others. And key to that, as a flip side to that coin, is that you need to be able to offer support and information. Others will respond reciprocally to that. As was just said by Ewan and Matt a few minutes ago, it's really important that you are honest, but you offer, because then you will get things offered in return. Part of that is, again, what was mentioned a few minutes ago. It's really important to practice active listening. to be able to understand what's going on through the course of the meeting. So you'll have done your prior research, the meeting will start, but you have to be adaptable, you have to be flexible, you have to think on your feet. But leadership is not about dictating, it's about actually directing the flow maybe, but not necessarily directing the outcome. Let things go in their natural course whilst maintaining a bit of direction towards the overall goal. And absolutely agree about that comment about the silence. You got to learn to love that awkward silence. It doesn't necessarily come naturally to most people. It doesn't come naturally to anybody, but it's something that I certainly found out a long time ago, early on in my career, is if you can learn to actually enjoy that silence, that pause, then as was said, invariably people do fill the void. And usually what you get is that they're really inherent, deep-seated views and comments coming out. Now, obviously, sometimes you might have to manage what's actually being said, but it's really important to actually get to that point of confidence in yourself and your own abilities. So you might not be the subject matter expert of that topic that you're being asked to chair. It might be out of your sphere of influence, but actually be able to employ these principles will actually lead to a really great outcome for the whole overall objectives of the meeting. You need to facilitate involvement through the meeting. It isn't just a case of the things I mentioned already, the active listening and keeping everyone involved and with you through the process. You have to actually facilitate that and be aware of, is person X really quiet because they're just considering their views before speaking, or is something else going on? Is there something that you need to be aware of? Managing the process of the meeting, something might happen. They might have got a message on their phone that they need to react to. It's all about just keeping a holistic sort of mindset about what these things are happening and what's going on in the room. But yes, definitely keep in mind what the objectives of the meeting are, what the objectives of the collaboration are, and focus, but not necessarily dictating the script. Find ways to help others to contribute if they're not contributing. Giving them time is a very easy and usually the most productive way of doing that. But be aware of any knock-on effects that wider relationships that you might not be aware of between individuals in the group might have, but also be aware of the truth of it, which is that as the meeting develops, as subsequent meetings take place, everybody will feel more confident and happier to contribute to the meeting, and eventually you get to the outcome that you desire. It's the same sort of core principles, whether you're whoever the group is that you're with, whether that's industry, NHS. It's the same principles, but you have to be flexible with them and yet stick to a non-rigid sort of skeleton framework for it that will get you to the results at the end of the day that you want to achieve.
And I just wanted to add on to that, Jim, as well. You're talking about collaboration in terms of meetings, and I think it's really important as well given everything we've talked about in this session, is that collaboration doesn't just stop with you've got everyone in a meeting room. You might have managed to get, everyone from all of the providers in a pharmaceutical company and whoever from NHS England in the room, but that's not collaboration. And actually it's then the skills that you then put in place throughout that meeting that is going to lead to effective collaboration. And it's that capability that needs to be developed by the leader to actually make collaboration happen, and not just bum everyone in a room and hope for the best. And I think I saw something in the chat as well about stakeholder analysis, and that stood out to me, certainly for anyone thinking about starting collaboration where they've maybe not done it before, and certainly outside of their own team and department, is if you have a problem, thinking about that wider picture of who else could this affect at some point in the lifetime of that issue. So say it's a medicine, because I'm a pharmacist, say it's a medicine, that might, the problem might be sat with me as a pharmacist in the hospital. But if I think about who else might be impacted by a change, well, then there's maybe the doctor who prescribes it, and there's maybe the nurse who administers it, and then there's maybe the doctor at the GP practice. And then there's also the patient at the end of it, and actually, well, the public as well, because they pay for it. So actually, if you think about that entire journey, you've just then found your stakeholders that you need to involve and figure out who needs to be at the table for that change at the start. Because otherwise, if you don't collaborate at that point, you'll get to the end of your project and the end of your change, and then someone's going to have a problem with it because they weren't included from the start. And so that's, I think, a really good starting point from my experiences anyway. So what we'll do now is...
If I may, Katie, just briefly, I think the challenge is once you've agreed something's purposeful, you want to do it, you've got the right people in the room, the issues that are going to stop that project being successful are there. And the question is, can you find a way of helping them come out onto the table? And I think for me, if you can do all the things you talked about and get those issues out and then work them through, then I think you're on a good footing, really.
Definitely. So now we've got some questions from ones that have been submitted. So we've got a question from Edward, which is, how do you move beyond pseudo collaboration in healthcare to achieve genuine purpose-driven collaboration that shares risks, embraces the discomfort of compromise, and leads to meaningful outcomes? And I guess part of that question that stands out to me is about the sharing of risks. And I guess, how do we do that? So does anyone want to jump forward on that one? That might be one for you, Matt, with the Provider Collaborative.
Yeah, I mean, it's tricky. I think the point about pseudo collaboration is a key one, isn't it? So it comes back to purpose. What is it that we want to do together? And actually, for us in the collab, there are things that different combinations of organisations do together. You don't have to do everything together, and I think that's key for me. It's not pretending we're going to do things that we don't mean to, and sometimes it takes us a while to be clear on those things. Sharing risk, we've got a series of, again, principles, as Jim talked about earlier, one of which is where there's projects where there might be a collective benefit, but some organisations will lose, that actually any surplus is distributed to offset those losses before you then look at anything else, to try and make sure that we can actually try and kind of net off some of the losses, share that risk a bit more sensibly, because it's challenging, isn't it, for people who work for statutory boards accountable for their populations to take a system approach. Unless you can put some of those kind of guardrails in place, it's difficult, I think.
I think if I can come in on that as well, Katie, I think just the word that stood out for me from that question is about discomfort. And again, it kind of comes back to that, but embracing the silence is also about embracing the discomfort when it's done in a kind of psychologically safe way. But quite often the temptation, if you're the chair of a meeting or the facilitator of a group, whatever, is to try and smooth over that tension and try and kind of make it go away. And actually, if there is compromise is uncomfortable, so if there is some tension, then it means you're closer to getting all the issues out on the table, as Matt says. And then the closer you are to getting the issues out on the table, the more everyone's got that kind of shared understanding. So I think leaning into that discomfort, if there's an uncomfortable conversation in the room, then that actually means people are being far more honest and open than they might otherwise be. So I would embrace that.
And then can you make sure you've helped people understand that everyone's approaching this from a different perspective? So the reason there's discomfort, as you say, is we're airing the views that need to be shared that help you unlock the context of the people who come to the meeting. I think you're absolutely right, Ewan.
It's that emotional intelligence, isn't it, about why there's expect that discomfort maybe, and then understanding why there is discomfort is really important. And there's something about the last line that stands out to me, Ewan, just even from our conversation earlier today about how we maybe work more with the pharmaceutical industry as the NHS in the future, with how we do sort of outcome-based payments. And it's maybe quite technical, but it's an example where we're asking across organisation boundaries to accept levels of risk, to share that risk between industry and I don't know what Jim's thoughts on this one will be, but rather than the NHS maybe taking the whole risk, actually how can that be shared with the pharmaceutical industry, and what benefits can that bring to both sides of the equation? And it might be uncomfortable because it might be new and it might be a change, and obviously then everyone's got a bit of risk, so that's uncomfortable if they didn't have it before. But actually, what are the longer term benefits to that relationship and to maybe having that risk in the short term for better outcomes in the future? So there's definitely, I think, a drive to work in that direction. It's just a bit of a transition to get in there as well. We've got another question from Pauline. So this one, Ewan, I'll give to you first of all, but if anyone wants to jump in, please do. When can collaboration be too much? Can you ever over collaborate? And in that situation, how would you manage expectations?
Yeah, I mean, it's the NHS kind of goes between a pendulum swings between collaboration and competition, and depending largely on who's in government at the time as to whether they think one is the answer or the other is the answer. I think quite often when I see collaboration over collaboration, that's kind of people trying to absolve themselves of risk or responsibility, and the idea that if we just have lots of people in the room, we'll all feel like we own this problem, and that's actually not collaboration. That's when you're in a room, everyone's got to feel like they kind of own an element of it, but are very clear about who owns what element of it. So I think there can be a feeling of, well, if we get everybody in the room, then we'll solve this together. But if you don't have the attributes, the personal attributes of the person kind of being the honest broker or driving that conversation, and the expectations of everybody in the room, and that kind of shared purpose, then I think you'll end up with a kind of a network or information sharing rather than genuine collaboration. But I think Matt said earlier on, what was it, 85% of things you think can be solved by an individual organization, and 15% require genuine collaboration. I think there is the risk that we try and push too much down that road, and as I say, quite often it's because someone wants to avoid making a difficult decision. So I think being constructively challenging yourself as the person who might be trying to drive some collaboration on, is this really the right thing to do, I think is important in that.
I'd agree, yeah. I mean, in terms of the numbers, as I say, as a mathematician, the numbers aren't that important, but it's around 80%, 15% you could kind of share dialogue, and then 5% maybe collective sort of solutions. And we only really use those numbers because it gives a sense of proportionality, doesn't it? For most things, organisations have got to take accountability for delivering individually, but there are some things where there's real benefit from collaboration. It's those things we've got to learn to be able to focus on. It is difficult, I think. It's tempting to, as you say, to try and do everything together, but you've got to be clear on the accountability.
A quick one, Jim, from the chat. Sort of similar in terms of over collaborating, but oh no, that's a different one that's popped up on my screen. So what are the structured opportunities for all stakeholders to engage and create aligned opportunities? From Clive.
It's a really good question, isn't it? So I think that what you actually need to do is, and just reassessing what the actual number of the question is, but what you actually need to do is to, again, it's going back to those core principles of, first of all, what are you trying to achieve from the collaboration, and who's in the room, and what do they actually have to offer contribution wise, and what are they seeking to achieve? So then from that, once you've done, and it isn't a massive full-time analysis that you need to do, but you do need to have that assessment that is completed, so that then you can judge what the opportunities for each individual are to be able to achieve what they want to achieve from the collaboration. At that point, if you've done that, and then you've done the other thing that we were talking about earlier on, which is building the relationships with the individuals, then you will know exactly what can be aligned between one another or certain groups within the wider meeting, so that there might be a handful who are very much wanting to achieve this one goal, but another group that want to achieve a slightly different goal, or with the overall objective of the collaboration still shared objectives, but they might have sub objectives that they're trying to achieve as well. It's only once you've done that background research, but then knowing who's in the room and built those relationships, that you'll be able to do that. From there, the rest of it actually will come pretty naturally to you.
Fortunately, that did actually also answer the question I was going for as well. So that was kind of about knowing how far and how wide to collaborate. Obviously, I gave an example there where you can list everyone in a journey of whatever change project you have or whatever the issue is. But that doesn't mean you should involve all of those people. And as you say, what is that background analysis work that you need to do first? Mm-hmm. And certainly plotting your stakeholders and thinking, well, who actually is very influential, who actually is going to be responsible for this, who needs to be actively involved, and actually who can just be kept informed about this, and really breaking up that collaboration into those different pockets.
Yeah, I think that it might, trying to put a bit of structure on it is useful at times, but it will come naturally. So if you are thinking of setting up a collaborative meeting, you will already have an idea of what you want to achieve in mind. You will already have an idea of who needs to be involved from different organisations or maybe specific individuals in mind. So these things will actually naturally stem from that very simple level of analysis. It does not mean that you need to go spend a lot of time actually rooting into granular detail of background analysis on everyone that will come into the room. But if you just have that very key top line sort of level of knowledge, that will allow you to have the conversations, build the relationships, and then it all will definitely stem from that.
Thank you very much. Any final comments from anyone? What would be your take-home message? Don't all jump at once.
Which we were just sitting comfortably with the silence there, Katie.
Oh, right, sorry.
I think we've covered a huge amount of ground in terms of purpose and shared intent, how to help people have positive but crunchy, sensible relationships, to think about the accountability. So I think we've covered a huge amount. I'm not sure there's one specific thing I could take away, but I think it's been a really, really useful conversation.
I think there's one thing I would add, and I noticed there's one question in the chat from Antonio as well about transitioning from technical expert to system leader. I think one of the key things is you've got to leave your ego at the door a little bit, because to have those difficult conversations and to not be, particularly when you've come from being a point of being a technical expert in a thing to a room full of people who might be experts on all sorts of different things, you've got to kind of not say, I'm the one who knows the most about this thing, so you listen to me. You've got to leave your ego at the door. Easier said than done.
And just for me, I'd echo those thoughts, and I think that it's really important to believe in the process, but not be rigid to it. Be flexible with what you want to achieve and the way you want to get there. Always keep in mind what you actually do want to achieve, and that's really important to have set the right goal from the outset. But be flexible in the way that you actually get to it, and to the point that we were discussing just a couple of minutes ago. You will find that there will be opportunities for subgroups to develop, or opportunities for further collaborations between groups within this group. So just always be flexible, always be confident, trust in the group and in the abilities of yourself.
I think my final take home, and then hopefully Amelia's going to pop back up to do closing remarks. But I guess mine would be always asking that question of, for whatever piece of work you're doing, who else should be involved in this? Who else might this impact, and should they be at the table? Maybe not now, but maybe in the future, but at some point, who else might this impact, and should they be involved?
Fantastic. Well, thank you all for today's session. Thank you to Katie. Thank you, Matt, James and Ewan, for your insights and expertise. Please do stay tuned to hear more about CMI membership, and thank you all so much for joining us.
Don't forget, as a CMI member, you can find the latest management and leadership insights at managers.org.uk. If you're not yet a member, join our community to discover CMI Confidence with on-demand resources, our network of mentors, and industry-leading accreditations.